This is The Common Health from the CSIS Bipartisan Alliance for Global Health Security, engaging senior leaders on questions of how to address our common health security challenges in this post-COVID moment. I'm delighted today to be joined by a close friend and an expert in global health security and biodefense, much admired here in Washington and beyond. That's Dr. Elizabeth Beth Cameron. Thank you, Beth, for joining us.
Thanks so much for having me on, Steve. I'm delighted to be here.
Beth is the professor of the practice and a senior advisor to the Pandemic Center at Brown University. Prior to that appointment, she did 2 tours at the White House and National Security Staff, where she helped conceptualize and found the National Security Council Directorate on Global Health Security and Biodefense in the Obama administration. That was eliminated by Bolton during Trump 1 and then restored. And you came in as the senior director at that time. And so you've done these 2 tours in leading on global health security and biodefense. Prior to that, senior positions at both the Department of State and Department of Defense. Outside of government, served as a vice president at the Nuclear Threat Initiative, NTI, on the biological policy and programs, where you put together the Global Health Security Index. She is a graduate of the University of Virginia with a BA in biology and a PhD from Johns Hopkins in biology at the Human Genetics and Molecular Biological Program at Johns Hopkins. So welcome.
Thank you.
I asked you to come in here today to be with us because we're having a series of conversations through this podcast trying to discern what is happening inside the government. And you're one of the people with the greatest big picture and close-in nuanced understanding of what is happening. We're now at the beginning of week 6 of the Trump administration. It's an astonishing period in terms of the scale of change that's underway. And it's a period of unprecedented upheaval and unprecedented uncertainty and threat to our executive branch capabilities that have been developed over many administrations to deal with biothreats, to prepare, to detect, to respond. And for many people, myself included, it can be quite confusing. We don't have necessarily visibility into everything. There's a lot of uncertainty. We have the transition between the 2 administrations still unfolding. We have this blizzard of executive orders, now over 75, that have been issued. We have the suspension or freezing of funding and programs. We have folks that are being put on administrative leave, probationary employees being dismissed. We're seeing reduction in force of career folks. So there's just this upheaval at multiple levels. And what I wanted to ask you to do today was try and give us an overview, an update understanding of when we're looking at biothreat capabilities, where have there been setbacks, temporary or permanent? What are the outstanding decisions still on the table? Where are we seeing some progress in terms of new personnel coming in to take on the duties that were filled by the Biden people? Give us a clear idea of this. Maybe you could start with, how do you characterize the personalities in the administration? And if there are factions or there are different perspectives, how do you characterize those?
Thanks, Steve. Well, it has been a blizzard. I think that's a great way to describe it. And one piece of my bio that we didn't talk about is that most recently, I was a senior advisor part-time to the U.S. Agency for International Development, and particularly the Global Health Bureau. So I'll just start by saying that it's really clear today that most employees at USAID, including those that detect, respond to, and deter biological threats, have either been placed on administrative leave or they've been told that they're going to be terminated. The contracts, including those that have been reported as being waived, have been stopped. And the latest number is about 10,000 grants and contracts in global health, including our ability to stop outbreaks at the source, have really been canceled. You asked me about the factions in government, and I think the way that it's shaping up, in my opinion right now, and it's not clear which of these sort of 2 factions is going to prevail. One faction, it's clear, is intent on really decimating the federal government, just really severely changing the way that the federal government operates. I think that largely leaves states and cities to manage disasters, including biological threats, and other countries to manage their own affairs. I think importantly, from a health security perspective, this faction has not yet seen the value in our deployed force. I'll call that our disease detectives at CDC and our USAID fighting force. against diseases like Ebola. These people are out there making sure that we're stopping outbreaks and, importantly, learning about them fast to keep them from coming here. And so this faction is really not very interested in those capabilities. I think that's dangerous. But there are a number of people in the national security apparatus still in government, and obviously a ton of civil servants that are still there who do want to see change in government, and change in government is necessary and it needs to happen. But they recognize how critical these people, these programs, this deterrence capability is for our national security. And it's right now, the first faction is clearly dominant. And the other faction is really slow to get in the game, and it's making people incredibly, incredibly nervous. And obviously, just to say, for all of the people that have lost their jobs out there, these are people who came to Washington in order to help people and help Americans. There's a reason USAID is part of the national security team and was on the National Security Council in the Biden administration. These are the people that stand in front of our military and are able to keep threats from becoming bigger disasters that something like our military would have to manage. So it's bleak. It's a bleak picture right now,
So
Steve.
let's try to unpack that a bit. You can think of it in terms of the people, the workforce, the experts. Let's talk about that. And then some of it is programmatic. It's the facilities, the programs, the capabilities that have been created. And then there's the broader defense aim of creating a protective deterrent or a shield that is going to keep these threats at a distance and keep bad actors from doing bad things. So you've got those three layers. Let's talk about the people side of this.
Yeah, so I like that framing. I've been thinking about this as the people, the programs, and then our protection or our protective shield. And so on the people side, I think it's really clear that we are losing, in the case of USAID, 90% of the staff.
How many people are we talking about that fall into this domain, would you guess? I mean, AID had 10,000 employees.
Yeah.
It's
so
now going to shrink down to about 600.
Yeah, we're down to an incredibly small number of people. And what I think that means for our, the people that are left, of which there's a very vanishingly small number who are doing things like fighting outbreaks at the source, what it really means is that we do not have people not only in Washington, but I think really critically, the people who are sitting in countries around the world who are responsible for finding out about outbreaks fast and responding effectively. I think these are people who are learning about disease threats in countries like Guinea, where in 2014, when we had the Ebola epidemic in West Africa, the U.S. government realized that we didn't have programs in partnership with the governments of West Africa to identify and stop outbreaks. There wasn't capacity. And so what that led to was a regional disaster in West Africa, where we could have lost 3 countries, but fortunately did not, to political instability. And we saw cases of Ebola come to the United States, multiple cases in the United States. We haven't seen a case of Ebola in the United States in a decade. And people who are part of this force that has been now reduced and demolished, really, they were the people who were out there making sure that that didn't happen.
So the personnel, the actual human talent, essential at home and in our missions abroad and our partnerships, is gone.
Essentially gone.
There is some kind of modest number of people who are there to preside over the last
as far as I know, I mean, every day, more and more people are losing their jobs. Of the team of people that I worked with and managed, I'm hard-pressed to think of more than 1 or 2 that are left out of hundreds.
Okay. And so it's not like anyone is going to reverse course anytime soon and put Humpty Dumpty back together. These people are gone.
These people are either gone or are hanging in the balance. I mean, this is something that if Congress made a decision to act, potentially they could do something. The courts are trying. But yes, these people are essentially gone. This is a capability that we would have to rebuild at this point.
Okay. So that's a profound and staggering reality.
It's a staggering reality. And what it means, and I've been listening to my friend and colleague, Craig Spencer, who is one of the doctors who responded to the Ebola outbreak in West Africa in 2014. He came home to the United States.
Yes.
He was infected with Ebola and he survived, thankfully. He's been speaking a lot over the last couple of days and weeks about how we are just not, as a nation, able to respond or understand even what's happening, for example, with the Ebola outbreak right now in Uganda because we do not have these people and these programs in place to be ready.
So it's a form of, we've eviscerated this capability. We've now blinded ourselves, in effect. Give me some examples of what we've lost programmatically. Give me 2 or 3 cases that, for our listeners who may not be expert in this, give me a few examples of the actual programmatic creations that are now gone.
Yeah, so one really, I think, tangible example for Americans to consider right now is that USAID has a biosurveillance effort, so an ability to work with countries to detect disease threats. And that includes providing lab capacity, providing tests, and it also includes having people physically present working with these governments. One of our major pieces of that biosurveillance effort has been completely stopped. This is a partnership that provides funding to partners in the United States, in North Carolina, in Kansas, in Washington, in Maryland. This employs people in the United States working on these programs, and that effort is gone. In addition, we have one of the things that USAID has been doing a lot of globally is understanding bird flu. This is really important right now when we look at how bird flu is spreading in the United States. I think everybody's worried about the rising cost of eggs and how we can do a better job of reducing the spread of bird flu here. USAID works with other partners to provide personal protective equipment, biosafety, biosecurity. They work with implementers like Cargill, centered in Kansas and Minnesota, to train farmers abroad and to understand how bird flu is spreading in other countries so that we can apply those same skills here. So these are just 2 really important examples, I think, of major programs that USAID's Global Health Bureau had in place that are gone.
The acting assistant administrator for the Bureau of Global Health, Nicholas Enrich, he was in that capability until yesterday when he was put on administrative leave. He released a document over the weekend. I think it was Sunday morning, then he was dismissed later in the day or put on administrative leave. A very stark and very detailed document that he had prepared tracing what the implications are of the destruction of these programs. It included biodefense and global health security. It included infectious diseases. It included a number of things and he was laying out what the implications would be, what the projections would be, what this would mean for the populations that are supposed to be reached, but also for the broader security of Americans. And that got front page coverage in all of the major newspapers in the United States and beyond. It's on the front page of the Financial Times, The Guardian in London, New York Times, Washington Post. Today, we get a tweet from Elon Musk, head of DOD, the lead entity in carrying out this revolutionary annihilation of capabilities, alleging that these programs are not there to protect Americans, they're producing bioweapons. So what do we make of these 2 things? We have this dramatic disclosure of what, within our own government, what the implications are of these changes. And it's excruciating and it's kind of breathtaking, the scope of this and the magnitude of what this is going to mean. And then we have an allegation coming over the transom that these are bioweapon programs.
Well, I think it is a staggering differential to see those 2 things in juxtaposition just within, several hours of one another, Steve. Nick Enrich is a career civil servant who has been doing an incredible job keeping programs running and people going, and just really in what can only be described as a heroic effort, documented for the department, for the agency, for the department, and now for the world, what these programs do, not only for people in other countries, but obviously for Americans. These are programs that are protecting us from disease threats. They're programs that are building a shield against global poverty, which can turn into terrorism. These are programs that help the U.S. Department of Defense. The U.S. Department of Defense did not want to go into the Ebola hot zone in 2014. They drew a red line, understandably so. USAID and CDC have to be our front lines of defense, and often the combatant commanders can't provide planes or boxes or supplies That's what USAID does when disasters threaten Americans and our bases and our homeland. And Nick, I think, laid out in very stark detail what these programs do for us. And I was very happy to see of course, it's important to see this issue laid out in front page news for all of us here in Washington, but it was really helpful to see it laid out in newspapers across the country, where hopefully Americans in all states can read and really start to understand these programs. In terms of the allegations about biological weapons, it's preposterous that the United States would develop and use a biological weapon. And as a national security professional who has served in 4 administrations, Republican and Democratic alike, including the Trump administration for several months in 2017, it's dangerous to be talking about the United States developing and using biological weapons. We do not have a biological weapons program. We are parties to the Biological Weapons Convention. And this norm that we have helped develop and we've really been global leaders in upholding is keeping Americans safe from biological weapons threats. So when we talk about the third leg of this stool, we have the people, the programs, and the protective shield. What I mean by that is when we show the world that we and our partners are capable of stopping biological threats early, we are also telling them biological weapons aren't going to be useful because we can find them, we can stop them, we can respond to them. Please don't use this weapon. Don't develop it. That's a really important part of our deterrence capability. We're here at CSIS. We spend a lot of time talking about the nuclear deterrent. The biological deterrent is our global health security efforts to prevent, detect, and respond to threats. And so I don't like to see attacks on that norm. I think it's incredibly dangerous.
Thank you. Let's talk about the legacy of the first Trump administration and how that plays in now. And what I mean by that is COVID struck in late 19 and early 20, dominated the last year of the first Trump administration. There were some remarkable achievements, Operation Warp Speed in particular, that are credited to the Trump White House. There were also lots of controversy and backlash against many of the measures and claims made about with the need for mandates, the need for disruption of schooling, of businesses, and the like. How is that memory of that? I mean, what we're seeing unfold today is driven to a very significant degree by a sense of grievance and desire for retribution against perceived slights or insults or defeats or whatever experienced during Trump 1. How is that memory playing today?
Yeah, it's a really great question, Steve. And I'm sure many of us have been thinking about this. Obviously, the Trump administration was heavily criticized about the sluggish response to COVID in 2020. We saw the states and the cities engaged in what you and I have called, Steve, sort of pandemic hunger games, where they were fighting each other for scarce supplies. But on the other hand, you mentioned Operation Warp Speed as a critical effort, which built on really longstanding capabilities and investments in infectious disease research. And so I feel like when we look at these two things together, we are again seeing these two potential factions shaping up, and it's really unclear what's going to happen. I think one practical outcome of this is that I think the administration will likely try to leave, and we're seeing this also with the cuts at FEMA, the Federal Emergency Management Agency, that the administration will try to leave more response capability to the states. And I think what that means is that governors, cities, mayors, tribal leaders are going to have to be prepared more independently and also have additional bridges for working together. The federal government often provides the glue for states, localities, tribes, and territories to work together. Many of us outside of government have begun to think, what is that glue going to look like if it's not the federal government, or if the federal government is severely diminished in its capacity to do that? So what could the National Governors Association do? What could mayors and governors do even to come together around H5N1 and to start talking about that? How can we see health alerts being coordinated across states if CDC isn't able to do that work? And when we look at, for example, the measles death and the cases in the United States, it's really important for states to be working together across state lines. And it's really unclear how that's going to happen in this administration. We may see some coordination still happening at the White House, bringing agencies together. But if those agencies don't have programs and don't have the ability to work together in the states in the same way, it's going to be hard to understand how that translates into a capacity to respond to something that moves across state lines the way an infectious disease threat, like we saw with obviously the COVID pandemic. So I'm expecting a lot more emphasis on states and cities.
Well, we've seen in this period, we've seen the extraordinary speed in which this destruction was enacted and the absence of guardrails or opposition to this, which also left people kind of speechless that we didn't have governors throwing themselves across the tracks. We didn't have members of Congress rising up in a rapid fashion. The courts have been pulled in, but the courts have not really slowed this process. There's been open defiance of the courts in many respects, but the courts have not slowed this process much. There's still some pending decisions.
Yes.
Agreed. And courts are not completely absent from this, but those that are in the destruction mode are winning up to now. When you look at governors, what we've seen most recently is Governors Pritzker, Healy from Massachusetts, Pritzker from Illinois, Mills from Maine, Newsom from California have become much more vocal. But it hasn't been so much around these issues. It's been mostly around the mass deportation threats, the DEI pushback, the transgender. It's a series of issues where they've objected to the legality of this or the illegality of much of what's being proposed and registered that in state laws. And so we haven't seen much evidence of this issue, a recognition or awareness that these issues now sit squarely in their laps with much less in the way of backstop support coming from the federal government.
Yeah, I think you're completely right, Steve. And we're also seeing the response to some of those issues breaking out somewhat on party lines. I think when it comes to disaster response, especially as we start looking at hurricane season and with bird flu circulating the way that it is in the United States, I wonder if one opportunity here for some bipartisan discussions amongst governors and mayors could be to be talking about these issues that clearly impact multiple states at once when they hit. Whether it's a smaller number of states during a hurricane that goes, that comes in, does damage and leaves, or whether it's an infectious disease threat that can affect the entire country and the world all at once. I think it's really clear that from our work, Steve, and the American Democracy and Health Security Initiative, it's completely clear that red states, blue states, purple states were equally frustrated with the lack of tools in their toolkit for responding to an emerging threat like COVID. I think red states and blue states are equally frustrated about bird flu, and I think all Americans are worried about the price of eggs and the bird flu threat. And so I wonder if, as we look at opportunities and places that we can focus time and attention, if one of those places might be around talking about practical realities associated with disasters. And I am, though, quite worried that when we see the decreasing focus on federal workers and federal programs and the decrease in our overall protective shield against these threats, that we are leaving the states to themselves. And I feel as though that is something that we will realize with great import when the first major disaster strikes.
I want to use this, what you just said, to put a bit more focus on the response to bird flu, H5N1, or highly pathogenic avian influenza. Two things. One is the administration last week introduced a new measure, a $1 billion initiative, focused particularly on poultry flocks. And I want you to say a bit about what that may tell us. Previously, HHS had committed on the response to H5N1 about $2.1 billion. Of that, a little over $800 million was going towards the national milk testing facility that was introduced at the end of last year. There was an additional $306 million introduced right at the end to support the states and the like. But now you have an additional $1 billion announcement around providing more support to poultry industry, some additional support on biomeasures in the way they do their business, more encouragement in the development of vaccines and diagnostics for poultry. What does this mean in your view?
Well, look, I think it's great that the administration is focusing some attention on bird flu. And I think it's important to focus on poultry and obviously on poultry farms that are greatly impacted by the threat. I think one of the key challenges with bird flu is that it's in the wild bird population, it's in wildlife, it's spreading in multiple mammalian populations. So focusing on
and now the dairy industry,
and the dairy
massively
industry,
impacted.
Of course. And focusing on poultry is important. We have to keep focusing on the dairy industry. we also have to be able to find the disease. And the wastewater surveillance programs are imperiled. They've been really important looking at wastewater to understand where we have large outbreaks emerging, being able to track the disease, and then being able to pinpoint our response to specific dairy farms and poultry farms. That's critically important. So I'd like to see a holistic approach to bird flu. The other one area I'd like to flag that was concerning last week is there was an article in The Hill that mentioned that there was potentially a rethinking of the contract for an H5N1 mRNA vaccine. And that's quite concerning because we don't have enough H5N1 vaccines for all Americans. And while not every American may want to take a vaccine, I do think every American is going to expect that they have access to a vaccine, especially
if we move into human-to-human transmission.
Absolutely. And especially if we see a flu pandemic affecting kids, as many flu pandemics do. So I don't feel that we are as well prepared. And I am worried about what that discussion about revisiting that mRNA contract, what kind of message that sends about the safety and efficacy of mRNA vaccines, which we know for COVID have been extremely safe and effective. So I would like to see a continued focus on that. Additionally, I think we need to start, as I mentioned earlier, seeing governors and mayors starting to talk to one another about bird flu. And if we can depolarize some of the conversations about it, I think that would be incredibly useful. And outside of government, we're thinking a lot about what kinds of toolkits state and local health officers and emergency managers need to adapt a bird flu response to their local context. We know people were very frustrated with having few decisions during the COVID pandemic about locking down, and how to reopen safely was very challenging for schools and businesses across the country. That's something we need to work on. We need to provide better tools, digitally adapted tools for short-staffed people to be ready for a bird flu pandemic so that when it comes, we are in a much better shape than we were. Unfortunately, I'm very worried with the changes we're seeing at the federal level that we're actually in worse shape than we were in early 2020.
I want to come back to the mRNA contract that BARDA gave out to Moderna. It was about $590 million to do the early trial work on the development of human vaccines for bird flu, so that the early work was underway, that the data on safety and efficacy would have been compiled. The bird flu could evolve and require tweaking.
Absolutely.
These are platforms that are meant to be faster than developing a vaccine making use of eggs, much slower process.
And also the eggs are impacted by the bird flu outbreak. So again, we're seeing a slower process.
And so this decision to pause on this grant was given right at January 17th, I think, the last few days of the Biden administration. It was awarded to Moderna.
Yeah.
So now in the first week of Secretary Kennedy's tenure as Secretary of HHS, this decision is announced around pausing and reevaluating this. And it comes at the same time that the FDA planned review around vaccines is canceled and the CDC ACIP is postponed indefinitely on that panel. And so it does look as though there's a new sheriff in town on vaccines. And that's raised a lot of alarm among those who are very worried that there's going to be further erosion of public trust and confidence in vaccines in this administration. Say a bit about that.
Yeah, I mean, Steve, you outlined it really well, seeing what happened with the ACIP at CDC and the FDA Review Committee. These external advisory groups are critical in actually ensuring safety and efficacy and hearing the data and being very public about their results. And I think seeing those mechanisms go away doesn't bode well for the very thing that the administration has been saying that it wants to see, which is a focus on safety. So in order to improve vaccine confidence and to address any concerns around vaccines, the very thing that we don't want to do is get rid of the ability to talk to experts in an external and publicly facing way that people can understand and participate in. I think bringing it back to sort of the two factions question, it's really unclear what's going to happen around our vaccine capability for emerging infectious disease threats that could cause an epidemic or a pandemic. On the one hand, we have a number of people still in the government, particularly in the national security apparatus at the White House and DOD, who are very focused on Operation Warp Speed 2.0. or what globally we'd call the 100 days mission, the interest in making a vaccine, a test, or a treatment for any virus that could cause a pandemic in less than 100 days. So that goal is something that many, including many in the administration, share. And that will require actually ramping up our capability to take each potential virus, from flu to Ebola, viral hemorrhagic fevers in general, to diseases like mpox, to literally take them off the table as biothreats by having a safe and effective vaccine, tests, and treatments ready to go that can be tweaked for whatever the strain that arises is. So we have this question mark, I think, and I really don't know what's going to happen, but it is quite concerning what's happening with the HHS advisory committees. And it's unclear how those two factions are going to talk to each other, and also what those interagency meetings are going to look like, where we have to put decisions on the table and actually make them for people during an emerging crisis. So I wish I had a crystal ball.
As long as we're in the blitzkrieg phase in which Doge and Musk are carrying forward this agenda of demonstrating their ability to seize control of personnel, data, financing programs, and the like, and execute this sort of siege effectively, that other faction's in a very weak position right now. Let's close with two questions. One is, what are the most important things that we just don't know or can't see today? Because there is a visibility problem on some of this. And you're in such a great position to help us understand what can we not see or know today. And then let's close on an optimistic point. Like, where do you see hope in this picture? Because this is a mind-bending and terribly depressing picture that we face now at this moment in history. At the beginning of the 6th week of this administration, we are really in trouble. And how you've described the pickle that Americans find themselves in, communities, mayors, governors, and others, is only just beginning to register, I think. So let's talk first, what do we not know or see?
Yeah, I think in the not know category, we don't know everything that's happening with Congress. I mean, we know that there's a lot of discussions, and we know that it's been challenging to fight many of these executive orders, but we do still have 3 branches of government, and we don't know what's going to happen with the budget. Many of these programs, I think PEPFAR is a really great example, the President's Emergency Plan for AIDS Relief, major program, tons of bipartisan support. The same is true for a number of other global health programs and health security programs. We just don't know if Congress will choose to fight back against some of the more destructive executive orders. So I'm going to choose to be a little optimistic that we'll see even more fight than we have. I think we haven't seen yet what will happen at some of the national security agencies on biological threat prevention, detection, and response, including the Department of Defense, which does have an enormous amount of capability. I think they rely a lot on FEMA and USAID, and I think that has not been as clear, I think, to some of the other parts of this administration, how hard it's going to be for the military to defend us against biological threats without a strong FEMA and USAID. But I'm hopeful that when we get more people into those positions, maybe there'll be a stronger viewpoint. And then I think it is, again, unclear. One thing that we just really don't know is when different emergencies are going to strike. And I'm certainly not hopeful that there'll be a large-scale emergency, but working in the White House every day, there's a mini crisis. And every month or so, there's a big one. And so I think this administration is going to start wrapping their head around, I hope, how important it is to be able to lead in crisis and how important these programs, these people, and this protective shield are for our ability to do that. Moving to, I'm not sure I can call it a truly optimistic note, but I think one of the things that many, at least in my field, are starting to think about is what are the things that we all recognize were not efficient about programs in government. And we certainly, none of us on either side of the aisle that I know would have recommended destroying these programs as the way to find efficiencies. But there are efficiencies to be found in bringing CDC and aid closer together on health security implementation, working with our partners and allies on measuring the same way, and working with countries to build a stronger compact for health security, where countries are putting resources of their own into health security and we are matching those resources. there are a number of programs like that. There's an opportunity here to develop a better biosurveillance system than we have right now. I mentioned Operation Warp Speed 2.0. That's another opportunity if the two factions can get together and decide that that's what we need to do to protect Americans. And I think that it is. And there's a few other things like how do we get to a place where there is less reliance on high-income countries for supplies during crises? We're all going to have to focus on our own citizens, but we also have to protect the world in order to protect ourselves. There need to be stronger health security financing capacities to be able to do that. So I'm choosing, while fighting back against the extremely damaging executive orders, I'm also choosing to spend some time focused on the future. I guess the very last thing, and where I would like to end, Steve, is the thing that gives me the most hope are the civil servants that are still in our federal government who came to Washington to protect our country and show America's leadership and values in the world, which does make us safer and stronger. And so many of those people are working under the most difficult circumstances, not knowing if they're going to have a job, minute by minute, day by day. And so many of them have lost those jobs abruptly without being able to plan for their families or even have a home to come back to for some of the people overseas. These people are working for everyone in this country, and they give me hope.
Thank you so much, Beth. Thanks for your leadership. Thanks for your generosity towards us always here at CSIS.
Thanks for having me, Steve.
Very grateful, and thank you for coming and being with us today. This has been extraordinary.
Thanks very much.
Thank you for listening to The Common Health. If you enjoyed this podcast, please give us a follow and leave a review. To learn more about the CSIS Bipartisan Alliance for Global Health Security or listen to other CSIS podcasts, please visit csis.org.